This is the stepwise airway OSCE. Present is Steve Harrison, CEP, and
Susan Dawson.
Sue, are you happy to start?
Yes.
Okay. So you are required to safely manage the airway of an adult and also demonstrate placing an adult into the recovery position, except we don't need to do that because you did that on your primary and secondary survey.
Yes.
So this is starting from your airway assessment.
Okay. So I'm going to use a cross finger technique to have a look inside the mouth, and it's all clear.
It has, in this case, there is vomit in there.
Okay. So I would suction and pop that in, just checking that I can see the tip at all times. Turn the machine on and using a circular motion for no longer than 15 seconds, work my way back up out of the mouth, turn the machine off and pop the suction down.
Okay, so we are suctioning on what direction?
On the number?
No, as in terms of the airway.
Oh, back towards,
Yeah.
so we're doing a circular motion,
Yeah.
back towards the entry of the mouth.
Okay.
So from down, out.
And
in,
where should
out.
the tip of my suction catheter be?
In my sight at all times.
Okay. Brilliant. In the airway, we have a solid object.
Okay.
So how are we clearing that?
With the McGill's forceps.
Okay, so how would
Okay.
you use those?
So I would first have a look, and then I would place my tongue depressor and torch together and use the McGill's and go in and remove.
Okay.
Yeah.
Fine. What would we do to manually secure the airway if the patient had a C-spine injury?
A jaw thrust.
Yep.
Yeah. So I already know that it's got a C-spine injury.
Yeah, we're concerned that there might be a C-spine injury.
Okay. So my fingers under the front of the jaw, lift and pull and move the jaw forward.
Okay, brilliant. And how would we do it if we had no concern about the C-spine?
A head tilt, chin lift.
Okay.
So head tilt, chin lift.
Yep. What am I considering as I'm walking up to the airway? What am I listening for?
Any abnormal sounds, any abnormal breathing sounds.
Okay. And how do I assess somebody's respiratory rate?
With your hands on the chest.
Yep.
So I'll do it this way. So you put your hands on the chest and feel the bilateral movement, an equal bilateral movement.
Okay. Can I put my face anywhere?
Yeah, you can pop your face to the and here and feel the breath.
Brilliant. My patient is unable to maintain their own airway. Can
Okay.
you demonstrate how you would secure that?
I would. So with a OPA,
Yep.
I would insert using the correct technique. Using the correct technique. Yeah. There we go. Make sure it's in place.
And you did it very quickly there. How would I know that's the correct size airway to use?
Oh, sorry. So I'll remove it again.
Yeah.
So I would measure from the incisors down to the jawbone.
Perfect. You did make that motion from this side, which the camera didn't pick
Oh,
up, but
sorry.
you didn't verbalise you were doing it.
So-
So put your OPA back in again then.
So there we go. There we go.
And if I wanted to tripod that airway, what would I do next?
So then you would use the NPAs,
Yep.
and you would measure from the nose down to the ear.
Yep.
You would pop some lubricant on it, either side, and then at a 90-degree angle, you would pop it in the nose, like so, and then do the same on the other side. Pop a little bit of lubricant on, 90-degree angle, and pop it in. You would.
Okay. Yeah, on some of the dolls I
I was just
appreciate
going to
it
say
doesn't
the
feed.
nose.
If you got resistance in real life, what would you do?
If I had proper resistance in real life, then I would take it out.
Okay, perfect.
Yeah.
Fantastic. If we were at the point where we're doing this on somebody's airway, what would I want attending?
A paramedic.
Okay. And let's say when we've done our look, listen and feel for breathing, my respirate is 5.
Okay, so then I would use the BVM.
Okay.
Okay, so I would place it over the nose using a C and E grip and gently pressing .
And how many breaths am I giving this patient?
5.
Initially, yeah, and then I'm giving a breath once every, how long?
It's gone off my head.
It's okay.
Every 2 to 3 seconds.
Is it? How many breaths a minute do I want to give?
60.
No,
No.
one breath a second am I giving? Or how many breaths a minute would be normal? What's the normal range for breaths per minute in a patient?
Oh, I don't know. It's completely gone out my
It's
head.
okay. We might come onto it next. So, a couple of questions for you then, if that's okay.
Yeah.
What's meant by the term airway patency, Sue?
Making sure there's a clear way for the air to get in and out.
Yep. What does my air enter through? What passages?
Your mouth and your nose.
Yep. If we recognise that my management isn't sufficient, what's available to my senior clinician?
So there's an eye gel.
Yep.
And then there's sort of surgical procedures that they can do. An
Yep.
ET tube.
Yeah, perfect. If we're managing the airway of a patient with a tracheostomy or a laryngectomy, within your scope of practice, how do you go about managing that?
Speak to relatives and carers.
Yeah.
And we could suction or for where we could see.
Yeah.
But that would be sort of it really.
Okay.
Speaking to a paramedic, getting a paramedic.
Okay. Is there anything I can do in terms of oxygen to that patient?
You can oxygenate them.
Yeah.
Is it 94 to 98?
It is, yeah, well done. What can a senior clinician do that I can't then?
They can actually take it out, replace it.
Okay.
Yeah.
Yeah. Is there anything they can set the suction unit to that I can't?
Yeah, they can set it higher, they can go and clean deeper into it, can't they?
They can, yes.
Yeah.
Well, to a point, can they use something that I can't, a particular catheter that I can't?
Is it the softer one?
I'd use the softer one, yeah. As in a tech would
Yeah.
use the softer one. What is it a paramedic can do? They can actually use the hard yanker
That's
if they
what I
need
meant.
to. Yeah. Sorry, it's okay. Why do I need to continually be reassessing the airway?
Because it can deteriorate.
It can. And then why is it so important that I ensure that my airway management equipment is well maintained?
Because of cross-contamination, you want to make sure that that the battery's always working on the suction machine, because you need it.
Yeah. And what might give me an idea that my suction equipment shouldn't be used before I actually fix it to the unit? What am I looking for to make sure is intact?
That all your catheters and everything, they're all in the packaging.
Yeah.
And that you've got a full battery on it.
Okay. And what's on the packaging that tells me it's safe to use?
The date.
Yes. Expiry date. Okay. So, back quickly, how many resps a minute am I looking for?
15.
Yeah, kind of anywhere between 10 to 20, isn't it? So if I want kind of that a minute, am I giving a breath how many seconds? Every how many seconds?
Every 3 to 5? No, 2
Kind,
to 3.
no,
Yeah.
you're right. Yeah,
Yeah.
kind of 5 seconds, 5 to 6
Yeah.
seconds is where we're at. Yeah. Make sure you're up on that.
I need
You
to.
should be counting 1 elephant, 2 elephant,
Yeah.
3 elephant, 4 elephant, squeeze. 1 elephant, 2 elephant, 3 elephant, 4 elephant, squeeze.
Yeah.
Make sure you're up on that.
Yeah.
Your technique is fine, and you were kind of doing it a little bit quick, but not worryingly so. But yeah, apart from that, well done.
Thank you.
Can stop that.